Welcome, and thank you for joining me today. If you've been experiencing brain fog after COVID-19, or you care about someone who is, you're not alone. In this video, we'll explore what doctors now know in 2026 about long COVID brain fog, what causes it, what symptoms to look for, and practical, evidence-based ways to support recovery. My goal is to give you clear, reliable information to help you better understand what's happening and how to move forward with confidence. Long COVID brain fog is a persistent condition that affects thinking, memory, focus, processing speed, and mental clarity months or even years after COVID-19 infection. Brain fog is not a formal medical diagnosis, but a term used to describe cognitive symptoms such as forgetfulness, difficulty concentrating, word-finding problems, mental fatigue, and feeling mentally slowed. These symptoms can interfere with daily life, work performance, and relationships. Brain fog can occur even after mild initial infection and may begin weeks after apparent recovery. Symptoms often fluctuate. Some people improve gradually over time, while others experience relapses, especially after physical or mental exertion, poor sleep, dehydration, illness, or emotional stress. This pattern reflects a broader post-viral condition that affects multiple systems in the body, not just the brain. Current evidence shows that long COVID brain fog is driven by several overlapping biological processes. One key factor is persistent low-grade inflammation. After the acute infection, the immune system may remain partially activated in some individuals. Ongoing inflammatory signaling can disrupt how brain cells communicate, affecting attention, memory, and mental speed. Another contributor is immune system dysregulation. Instead of returning fully to baseline, the immune response may remain imbalanced. This can alter neurotransmitter signaling and neural network function, making the brain more sensitive to stress and fatigue. As a result, tasks that were once easy may now feel mentally exhausting. Changes in small blood vessel function also appear to play a role. The brain depends on tightly regulated blood flow to deliver oxygen and nutrients. In some people with long COVID, microvascular regulation is impaired, meaning very small blood vessels may not adjust flow efficiently. Even subtle changes in oxygen delivery can reduce cognitive performance, particularly during sustained mental effort. There is also growing evidence of altered brain energy metabolism. Brain cells require large amounts of energy to function. Disruptions in how cells produce and use energy can contribute to mental fatigue, slower thinking, and difficulty sustaining attention. This helps explain why people with brain fog often feel cognitively drained after short periods of concentration. Autonomic nervous system dysfunction is another factor for some individuals. The autonomic system controls heart rate, blood pressure, and blood flow to the brain. When this system is dysregulated, people may experience lightheadedness, rapid heart rate when standing, temperature sensitivity, and reduced cerebral blood flow, all of which can worsen cognitive symptoms. Importantly, most people with long COVID brain fog do not show major structural brain damage on routine imaging. Standard scans are often normal. However, more sensitive testing sometimes shows subtle functional changes in brain networks. This suggests the issue is more about how the brain is functioning rather than permanent tissue injury, which is encouraging because functional changes can improve over time. Common symptoms of long COVID brain fog include short-term memory problems, difficulty focusing, slowed thinking, trouble finding words, mental fatigue, and feeling overwhelmed by complex tasks. Some people also experience headaches, sleep disturbances, sensory sensitivity, dizziness, and mood changes. Symptoms can vary day to day and may be influenced by activity levels, sleep quality, hydration, and stress. Risk factors include more severe initial illness, repeated infections, inadequate rest during recovery, sleep disorders, anemia, vitamin deficiencies, hormonal imbalances, dehydration, blood sugar instability, and autonomic dysfunction. However, brain fog can occur even in people without obvious risk factors, and it affects adults across a wide age range. Management focuses on supporting recovery and avoiding symptom flares. One of the most important strategies is pacing. Pacing means balancing activity with rest to avoid post-exertional worsening of symptoms. This applies to both physical and mental activity. Learning to recognize personal limits and stopping before exhaustion can help prevent setbacks. Sleep optimization is critical. Poor sleep worsens memory, attention, and mental clarity. Maintaining regular sleep schedules, reducing late-night screen use, creating a dark and quiet sleep environment, and addressing sleep-disrupting conditions can significantly improve cognitive symptoms over time. Cognitive rehabilitation strategies can help people function better day to day. This includes breaking tasks into smaller steps, using reminders and planners, minimizing multitasking, and gradually increasing cognitive load as tolerated. The goal is steady reconditioning without triggering symptom flares. Physical activity can be beneficial when individualized. Gentle, low-intensity movement supports circulation, metabolic health, and brain oxygenation. However, exercise should be introduced slowly and adjusted based on symptom response. Overexertion can worsen brain fog, so gradual progression is key. Addressing contributing medical factors is also important. Conditions such as anemia, thyroid dysfunction, vitamin deficiencies, sleep apnea, dehydration, and unstable blood sugar can all worsen cognitive symptoms. Treating these issues can lead to meaningful improvement in mental clarity and energy. Nutrition plays a supportive role in recovery. Adequate protein intake, consistent hydration, stable blood sugar control, and diets that support metabolic and inflammatory balance may help reduce fatigue and support brain function. While no specific diet cures brain fog, regular nourishment supports the brain's energy needs. Mental health support matters. Living with persistent cognitive symptoms can be emotionally draining. Stress and anxiety can worsen autonomic and inflammatory responses, which may intensify brain fog. Learning stress management techniques and having emotional support can improve quality of life and symptom resilience. The course of recovery varies. Many people experience gradual improvement over months with supportive care. Others have a longer fluctuating course. Recovery is often non-linear, with progress followed by temporary setbacks. The presence of brain fog does not mean permanent brain injury. The brain has strong capacity for recovery and adaptation. As research continues to evolve, care strategies are becoming more refined. The focus in 2026 is early recognition, symptom-guided pacing, addressing contributing factors, and coordinated care to support gradual recovery. If you're dealing with brain fog after COVID-19, your symptoms are real and improvement is possible. Progress may be slow, but consistent small steps can make a meaningful difference over time. If you found this video helpful, please like, subscribe, and share for more evidence-based health education.